Can you tell the difference between a cold, the flu, and RSV when your child is sick? This is a question that challenges mothers and fathers every single day, especially during peak respiratory season. Many parents simply cannot distinguish between them. These three distinct viruses can present with nearly identical symptoms at the very beginning. A cold, the flu, RSV-A, cough, a fever, a runny nose. These are the universal signs of a child feeling unwell. But underneath that common surface, these illnesses act very differently. Watch this video to the end to find out. One small proactive step can change the entire course of your child's sickness and your family's stress level. A quick diagnostic test, often costing around $10, can give your doctor the crucial information needed to identify the exact cause. That one small step can potentially save a family thousands of dollars and an immense amount of worry. However, what if it is something more? What if that cough is the opening sign of a more serious infection brewing in their tiny lungs? The uncertainty creates a heavy weight of anxiety. You watch their every breath, you check their temperature constantly, and you hope for the best. This waiting and watching can feel agonizing. It is in this critical early window that a decision must be made, and guessing can have significant consequences for your child's health and your finances. A simple test providing a clear answer is a powerful tool against uncertainty. Think of it as a clear map in an unfamiliar, dense forest. Without it, you're navigating by hunches. With it, you have a direct path forward. Knowing whether it's a cold, influenza, or RSV lets your provider make a targeted plan. It transforms care from reactive waiting to proactive action. This isn't overreacting to every sniffle. It's using affordable tools modern medicine offers to protect your family. The stakes are too high to rely on guesswork when an answer is readily available. This is the core of the $10 decision, an investment in certainty, targeted care, and peace of mind. For less than a movie trip, you can gain knowledge that empowers better choices. That knowledge can mean managed sickness at home instead of an ER trip in the night. That choice begins with a simple question. Doctor, can we test? The common cold is the most frequent and generally the mildest of these three respiratory illnesses. It's one most children will get multiple times a year, building their immune systems as they go. Unlike the flu, a cold usually starts slowly creeping up over a day or two rather than hitting with sudden force. Initial symptoms: a runny or stuffy nose, sneezing. A mild cough can develop, but it's less severe than the deep, chesty cough of flu or RSV. High fever is uncommon if present, it's usually low-grade. Many kids stay relatively active and keep eating and playing, just a bit more tired than usual. Colds are most common in young children, especially those in group settings. Daycare, preschool, elementary school. Those places are breeding grounds for hundreds of cold viruses. Close contact and shared toys spread germs fast. Toddlers can have 6 to 8 colds a year. Normal, though frustrating. The main risk is secondary infections, like an ear infection or a sinus infection that might need a doctor. Home care is simple: comfort and support. Key elements: hydration, rest. Encourage fluids, water-diluted juice broth. Let them rest. Ease congestion with saline drops and a cool mist humidifier. For coughs, a spoonful of honey helps for kids over 1. Never give honey to infants. Most colds clear in 7 to 10 days. Influenza, commonly known as the flu, is a far more serious and formidable opponent than the common cold. One of its defining characteristics is its sudden and intense onset. A child can seem perfectly fine in the morning and be completely miserable by the afternoon. It often feels like being hit by a truck. The symptoms are typically more severe and systemic. A high fever is a hallmark of the flu, often spiking quickly and leaving the child very unwell. Body aches and muscle pains, severe headache, profound exhaustion or fatigue, a dry, hacking cough, chills that cause shivering. Unlike a cold, a child will likely have no interest in eating, no interest in drinking, no interest in playing. Certain groups are at a much higher risk for developing serious complications from influenza. Children under the age of 5, especially those under the age of 2. Infants under 6 months old are at even greater risk and are too young for the annual flu vaccine. Children of any age with underlying chronic health conditions are also at elevated risk. Asthma, diabetes, heart disease, lung disease. For these children, the flu can exacerbate existing conditions and lead to severe outcomes like pneumonia that may require hospitalization. Proper home care for the flu centers on managing symptoms and preventing complications. Rest is absolutely essential. The body needs all its energy to fight the infection. Pushing fluids is equally critical to prevent dehydration. Offer water, offer electrolyte solutions, offer diluted juices, offer fluids frequently, even if the child only takes small sips. You can use age-appropriate fever-reducing medications like acetaminophen or ibuprofen. Always follow the dosing instructions carefully. This is where early testing becomes so important. If a doctor confirms the flu with a rapid test within the first 2 days of symptoms, they can prescribe an antiviral drug. These medications can lessen the severity of the illness and shorten its duration, making a real difference in your child's recovery. It is vital for parents to know the urgent warning signs that indicate the flu has become a medical emergency. Difficulty breathing, rapid breathing or shortness of breath, bluish lips, pale skin. If your child is so sleepy that they are difficult to wake up, or if they are not interacting with you, seek care right away. Persistent vomiting that prevents them from keeping fluids down. A high fever that continues for more than 3 days despite using fever reducers. RSV, which stands for respiratory syncytial virus, is the illness that many parents know the least about. Yet it can be the most dangerous, especially for the very young. In older children and healthy adults, an RSV infection often mimics a common cold, causing mild symptoms like a stuffy nose and a cough. This is why its potential for harm is so often underestimated. In babies and toddlers, however, RSV can be a very different and much more serious disease. It has a tendency to infect the small airways of the lungs, a condition known as bronchiolitis. The symptoms to watch for include a persistent harsh cough, wheezing, a high-pitched whistling sound when breathing out, and visibly fast or difficult breathing. In infants, one of the first signs can be poor feeding, as they struggle to breathe and suck at the same time, have a low birth weight, or have weakened immune systems. The same is true for young children under the age of 2 who were born with congenital heart problems or chronic lung problems. In these fragile populations, RSV is not just a cold, it is a leading cause of hospitalization. The virus can cause so much inflammation in their tiny airways that they are unable to get enough oxygen on their own, requiring medical intervention to support their breathing. A recent large-scale peer-reviewed study published in the prestigious journal JAMA Network Open has shed more light on just how serious RSV can be. The research confirmed what pediatricians have long observed in their clinics and hospitals. RSV often causes more severe illness and leads to more hospitalizations in young children than influenza does. Home care for a mild case of RSV is focused on supportive measures to help the child breathe more easily. Using saline drops in the nose followed by gentle suction with a bulb syringe can help clear mucus, especially before feedings and bedtime for infants. Offer fluids frequently in small amounts to ensure they stay hydrated. A cool mist humidifier can add moisture to the air, which may soothe inflamed airways. The scientific community has been working for years to better understand the comparative impact of different respiratory viruses on children. One of the most insightful and clarifying pieces of research on this topic was published in JAMA Network Open. This was not a small, isolated study. It was a comprehensive review that examined a vast amount of hospital data, providing a clear and statistically significant picture of what happens when young children get sick. The findings sent a clear message to parents and pediatricians alike. RSV is a formidable threat that, in many cases, poses a greater risk to young children than the flu. The study meticulously documented that infants and toddlers infected with RSV were more likely to develop severe respiratory complications. The researchers dove deep into the data, comparing the outcomes for children hospitalized with RSV against those hospitalized with influenza. The results were stark. They found that the rate of severe breathing problems, the kind that require intensive medical support, was notably higher in the RSV group. The choice a parent faces in the early days of a child's illness can be framed in simple economic terms. On one side, you have the proactive option, the $10 decision. A simple $10 rapid test next to a long, intimidating hospital bill. Rapid diagnostic tests for influenza and RSV are widely available and relatively inexpensive. Out-of-pocket cost can range from about $10 to $30. These tests are fast, often providing a result within 15 minutes. They arm your doctor with definitive knowledge about what is making your child sick. If the test is positive for the flu, the doctor can prescribe antiviral medication that can shorten the illness. If it is positive for RSV, the doctor can provide a clear plan for monitoring your child's breathing and instruct you on exactly what warning signs to look for. Now, compare that small controlled cost to the potential financial explosion that comes with delayed care. Waiting to see if things get worse can be a costly mistake. That waiting period might lead to the illness progressing to a point where a simple clinic visit is no longer enough. Your next stop becomes the emergency room, one of the most expensive points of entry into the healthcare system. An ER visit alone can cost hundreds or even thousands of dollars. If the child's condition is severe enough to warrant admission, the costs begin to multiply at an alarming rate. A hospital stay for a pediatric respiratory illness can rapidly escalate into a bill totaling many thousands of dollars, a financial burden that can cripple a family's budget. Let's break down the potential costs of delayed care more clearly. Multiple visits to a pediatrician, urgent care, as the illness worsens, each with its own copay. If breathing becomes difficult, a call to 911 might be necessary, introducing the cost of an ambulance transport. In the emergency room, the child will undergo a battery of tests, including blood work, a chest X-ray, each with a separate charge. If admitted, the daily rate for a pediatric bed. Medications, respiratory therapy, oxygen support, consultations with specialists. In the most severe cases requiring a stay in the pediatric intensive care unit, the daily costs can be astronomical. The worry over your child's health is compounded by the crushing weight of a financial crisis. This stark contrast highlights the incredible value of that initial $10 decision. It is a form of preventative spending. By investing a small amount up front, you gain the knowledge to potentially avert a much larger, catastrophic expense down the road. It is about making a smart, informed choice that protects your child's physical health and your family's financial health. When you look at it this way, the decision to test is not an expense. It is a critical investment in risk mitigation. Your final takeaway from all of this information should be a clear and simple mandate: do not guess. When your child is sick, especially very young or with underlying issues, guessing is a risk you don't need to take. Your first step is to be a good observer. Pay close attention to symptoms. Tell your doctor everything. Describe breathing, fast, noisy, labored. Detail feeding and fluids, refusing to eat, refusing to drink. Explain energy, tired but responsive, difficult to wake. Then ask the crucial question: Doctor, could this be the flu or RSV? Can we perform a test to be sure? Be a proactive advocate. In medicine and parenting, knowledge is protection. It empowers calm, rational decisions. Knowing the specific illness helps you, your child, and your medical team make the right choices. This safeguards your child's health. This protects your family's well-being. Please subscribe, like, share the video for more Body Bucks investments. Thanks for watching.